Hi, we are group 5 of this IPE, and then we discussed over this case too about the mother with an HIV and following ethics and discussable criteria. So we're gonna start discussing.
Okay, so for the first question, what is the scope of practice for each professional named in the case? So we thought that we have a quote here. According to the American Association of Nurse Anesthesiology, CRNAs have the obligation to protect patient privacy, including confidentiality of patient information, except when necessary to protect the patient or other persons, or when required by law. So, in this specific scenario, it is the CRNA's duty to protect the father and baby from contracting HIV from the mother by reporting both the mother's health status to the father and to the health department. In the state of Texas, it is legally required for healthcare providers to report confirmed cases of HIV. The obstetrical provider and or nursing team would also be legally required to report the woman's health condition to both entities.
All right, for question number 2, personal feelings aside, what roles does an interprofessional team have in engaging the parents? Like Ashley said before, throughout the communication between interprofessional team members, there is an unnecessary detail should be kept private and confidential, and the patient is not required to reveal any private information. However, since the result is positive, we need to inform the patient that it is legally required to report her disease as it could harm the baby and her husband. And we could assume that she is sexually active, and if she hides that from her family, it harms other person around her, and it is healthcare professionals' responsibility to protect further harm and spread.
So for the next question, what are the public health implications and how do you balance surveillance with privacy? We thought without disclosing her HIV status, the mother could spread HIV to her sexual partners as well as her child, who could then go on to spread it to other people in the future. And so every patient deserves privacy regarding their private health information. However, when a patient is unwilling to disclose information like their HIV status, it is the job of the healthcare professional and professional team to try to convince the patient to disclose their status to their partners. If not, tell the authorities, and if the authorities do nothing, alert the third party who is endangered according to the AMA Journal of Ethics.
For the fourth question, Texas law says that all patients are required to undergo HIV testing at the initial prenatal visit and in the third trimester. Repeat HIV testing between these two periods is done for any patients with signs or symptoms of HIV or a known exposure to HIV.
For the last question, how should a nurse, anesthetist, nursing team, and pharmacist respond if the husband asks what the medications are for? We concluded that they should respond by stating, since the medications are for the wife, we can't really tell him what the medications are for, even though we know that it's required to tell spouses or sexual partners of HIV diagnosis. We didn't really believe that that applied to medications.
All right, that is end of our discussion, and thanks for your time listening to us.